So we're going on to conditions of pregnancy, and these are just some of the ones that you may hear about people having cravings and aversions. And look, it has been linked to possible nutrients that we may be lacking as well. So you can see here that we might see that, you know, someone's craving, say, bananas. It could be potassium, magnesium. You may even hear of people having this extreme one here, which is pica, and that's craving things such as, it's an extreme form, clay, soil, ice, laundry powders, soap or chalk, and it has been linked back to some of those minerals as well. Some of the other things I've mentioned also about nauseousness. There is some research to show that having a B6 supplement could actually help to alleviate some of those issues. It's a very common symptom in pregnancy, and about, up to 80% of women experience this between sort of weeks 2 to 6. It doesn't always resolve in the first trimester. Sometimes it can go on, but it usually resolves around sort of week 20. We can get an extreme manifestation of that, which sometimes does require hospitalisation. And I've actually had a couple of friends that have had this, and they had to pretty much lie on their back for most of the pregnancy. There's lots of gastrointestinal changes as well, and this is when we see this is influenced by the concentrations of progesterone and estrogen. And what this can do is we have a results in an increased absorption of nutrients. So we get an increased absorption of nutrients. We may also get GORD, which is gastroesophageal reflux disorder, and that's really common later in pregnancy. And the hormone we've mentioned, relaxin, before, the hormone relaxin, has its effect on all ligaments, okay, so it tends not to close off the flap, and what we're doing is we're getting that cardiac sphincter is relaxed, and we get the delayed gastric emptying, and you might get a more sluggish small intestine, which can also lead to things such as constipation, and this is all due to that hormone relaxin. It is a wonderful hormone, but it can also cause some problems as well. The gastric juices are also reduced, gastric emptying is slowed, and it's not just only motility of the small intestine, the large intestine motility is also reduced. Water absorption from the colon is increased, so that's when we get that constipation. We have an increased appetite, sometimes you get that, I've mentioned, nausea and vomiting, and also a change in the taste sensation. And that, and even smell, that's the other one too. People find sometimes their smell can be quite enhanced. They may find certain foods that they really enjoyed before, they completely go off. They may have cravings for certain things. That delayed gastric emptying is a result of progesterone. So that's the changes that tone and the motility of the gastrointestinal tract. One good thing is that we do have an improved absorption of amino acids, and we also have an improved absorption of calcium. So we actually get better at absorbing calcium. There are some other concerns as well. You're more likely to end up with insulin resistance in pregnancy. Has been linked with diabetes. So type 2 later on in life. Sometimes women that get gestational diabetes end up having blood glucose regulation issues later on. Stretch marks are common as well. These are some of the concerns. They can occur about 90% of women. Thrush, leg cramps, restless leg, hemorrhoids, broken capillaries, hyperpigmentation disorder, pelvic instability I've mentioned before. Pelvic instability, particularly of the SIJ, the sacroiliac joint, and the pubic symphysis. Fluid retention and hypertension, especially when we get into later in the pregnancy.